Hello everyone. Welcome to Career in Pharma and welcome to one more episode of our Expert Talk Show series. Now in today's Expert Talk Show, we have an expert. She is nursing graduate by qualification and now she is working inside pharma industry. Now, through this podcast today, we will understand how any nursing graduate can make a career inside pharma industry. What could be the challenges, and what could be the things you should look forward for if you are looking forward for a career inside pharma industry. So let's start this with our expert without any delay. Yes, good morning, Athira.
Good morning, Neema. Good morning.
Yes, how are you?
I am good. I am good. Thank you. How are you?
Yes, we good too. So yes, we'll start this podcast.
Sure.
Yes, our audience are waiting.
Sure.
So Atira, I want to understand your journey
Okay.
from being a nursing graduate till today, making a
Okay.
good career inside pharma industry. How this happened and what inspired you to take this shift?
Sure. As you said, I'm a graduate in BSc Nursing from Kerala University of Health Sciences. So, immediately after my course completion, even before the results, I started to look out for other opportunities which is not related to the actual nursing job for particular reasons. And it took me a good amount of time to come across with this particular course, PG Diploma in Clinical Research, which till then I had never thought about, honestly. And joining that program was my very first step to this industry in clinical research because from them I got this idea about the industries and the companies, and I gave my very first interview during a walk-in session, and I got selected as a trainee coder. But that transition was never easy because it was not a conventional path. And at that point of time, the information about all these options were very limited. The accessibility to knowledge was restricted. However, I got the opportunity and I chose differently, and here I am. So, to answer the other part of your question, what inspired this transition? Was the realization that I wouldn't be a good fit for conventional nursing roles. However, I still wanted to stay connected to what I had studied, and eventually I found a place I where truly I fit in. Yeah, so that's the answer.
So, Atira, let me tell you, for the first time, we have an expert who was very clear in the college itself that, that person is not a right fit for the clinicals.
Yes.
So, having that awareness is very important
Yes, right, I agree.
because, yeah, many times, we already have experience in clinicals, and after getting experience, we realize, oh, it's not for me.
Right,
So that
right.
is one very important point, having awareness, like
Yes,
Athira had. So Athira, I'm
yes.
very curious to know, like when you completed your, like in which year and from where you got this walk-in opportunity. Yeah.
So I did my I mean it took, as I said, it took me some time. So when I completed my graduation, I did few other courses as well. I was pursuing for government jobs as well. Then I got into this idea of PG diploma courses which were available at that point of time, and I did it from Kerala itself. And immediately after that, in 2018, I started as a trainee coder, and I still work in the same department. It's been 7 years.
Oh, great.
Yeah.
Great. So, yes, with this, I just want to make a summary of this, what we discussed. Yes, having
Okay.
awareness about yourself is very important.
Yes.
So, yeah, for some people, it comes late. For some, like you had that awareness in college itself, just the struggle time reduced down if you are very much aware and clear in the
Right.
beginning of your career.
Right. Right.
Yes. So I just want to know, yes, like you mentioned that it was not an easy transition.
Mm-hmm.
It was never easy, although you were aware and you were clear. So
Yes.
what were the challenges you faced during this transition?
As I said, first of all, it was not a conventional field, and at that point of time, I never even heard of clinical research, like such research process exist, even though we had a few inputs during our nursing education. But I guess that starting point would be the time I joined that PG diploma course, because then I got this idea, like there is an industry like this, we have so many companies, and we will have so many misconceptions, right? Because being a nurse, I can only work maybe as a nurse or maybe as a tutor, and that's it. But that period, like it, as I said, it took me some good amount of time, but then I understood, okay, yeah, we have some other fields also where we can go and explore with the professional nursing degree I hold. And eventually that led me to pharma industry, and I'm very happy about it now when I look back.
Yes. So, Athira, also I want to understand. Okay, so this is the part where you were transitioning.
Hmm.
Now, when you joined your first job into
Yeah.
non-clinicals, what challenges you faced? Because you're coming from a nursing background where you are
Hmm.
dealing with patients.
Right.
What kind of challenges you faced in your job, first job?
In my first job, I didn't face much of a challenge and all, because I got very good trainings and classes when I joined at the first time in my first company. So I joined in a CRO. So we have CROs and sponsor companies, right? The contract research organization and the sponsors. So I started my career with a CRO where they have provided me almost all the basic training. So that was my foundation. And then I just had to build up on that. And I wouldn't say that it was that much difficult. It was very new. I mean, entire thing was different. It was completely new experience and everything comparing with what I did in clinical as a nurse or as a nursing student. But this is, yeah, something different, but I liked it. So I wouldn't say much of a challenge. Just, yeah, we have challenges in almost all the industry, in corporates as well. But once you like it, yeah, just we can go with the flow.
Yes, so true. Go with the flow.
Yeah.
And I mean, yes, with this, let me summarize this part like you mentioned, because you did some course. So
Yeah.
that made a foundation. So,
Right.
yeah, for all the audience who are listening to this, it is always suggestible, advisable, and a good thing to make a foundation before
Right.
you start anything new. So that is very important, and that very much was easy for Athira also, because she already made a foundation through the program.
Right.
So yeah, with this, Athira, the next question is: as per you, what are the key skills any
Hmm.
nursing graduate, or for that matter, any graduate who want to transition into pharma industry, they should have the key skills?
Sure. So the first one would be a thorough knowledge about the medical terminology. You cannot compromise on that. That's the first one. Then second would be the basics of pharmacology. Then a good understanding of clinical research, the overall process. And they should be a strong communicator, and the interpersonal skills should be very strong. And yeah, last but not the least, computer and technical skills, because we work with different systems and tools and laptops, right? So yeah,
True.
these are few key skills that a nursing graduate needs to
Yes.
transition into this industry.
Yes, so very well said. Yes, all these are much required key skills.
Yeah.
So, just to summarize it, you should be having good understanding of medical
Yeah.
terminologies, then pharmacology, and
Right.
yes, communication, very important,
Yes, it's the
and
key.
computer skills, key.
Yeah.
Correct, correct. I have seen people who are good in their knowledge, who are very good at computers also, but just because they lack the communication skills, they are not so much progressing in their career.
Right. We see it all the time, Nima.
Yes. So, yeah, no one teaches this in our college. No one
Nobody.
tells how much important communication is.
Exactly.
Even, this is an irony actually, especially anyone coming from a medical profession. Okay, doctors, nurses, pharmacists, where we have to talk so much with the patient. but no one tells about communication. That is also a
Right,
part of communication,
right,
right?
right,
So
right.
that is still an irony, I would say, in our colleges.
Right, because the way we talk with patients in a
Mm,
traditional nursing system and the way we talk with people or colleagues or managers or everybody in a corporate setting is entirely different. So, yeah, we can develop that skill gradually, but still, it's always better to get some
mm.
trainings and some hands-on experience on each and everything.
Correct, correct. So, with this next question, Athira, is what are the common misconception, which any nursing graduate could have about working inside pharmaceutical industry? Because nowadays, if just few hours, like, they think that it's complete work from home. They think that maybe it's from home or on computer, so it would be very
Right.
easy. So, what are those few misconception as per you?
Right. So that's actually a very good question, Nima. So, one very common misconception would be by hearing this title, like clinical research, most of them think that only doctors can do it,
Mm,
or maybe scientists can do it, or pharmacists can do it, by hearing the
mm.
words like drug research and everything. But
Mm,
that's not true. Nurses can do it, nurses are doing it, and there
mm,
are plenty of nursing graduates who are currently working in the industry. So that's one. And another one would be so there is no direct patient interaction in our field, right? Especially being a coder, there is no direct face to face interaction with any of the patient unless, yeah, you work in the sites or something.
mm,
So usually the nurses or the graduates they'll think that they won't make any impact because there is no direct contact. But that's wrong actually because nurses in pharma play much bigger roles, contribute to much bigger areas like drug development, patient safety, education, public health, and often impacting far more patients globally than in a traditional setting. So that's a very common misconception, I would say. Like it's we
mm,
cannot say that they are wrong also because this knowledge is never there out, right? So it's very common thinking like that. Yeah, I was working with a patient, but here I don't see anyone. So
mm,
yeah, that's there. But I guess we have to educate them on this because of the uh, definitely it will impact much more patients globally once the drugs comes out. So yeah, that would be another one. And yeah, as you said, some people think that we are 24 into 7 attached with our laptops, and sometimes they'll think it's every day it's like working from home, where in nursing you can actually go and see patients, interact with them. But it's not like that. Yeah, you have flexibilities. That is one thing.
mm.
That's why we say work from is important, so you can choose it, all these flexibilities and all these perks that comes along with this particular career. So I guess yeah, these are some common misconceptions to answer your question.
Yes. So yeah, the first part I really liked it, like because after listening this research word, people
Yeah.
think this is for it's for scientists working in
Exactly.
labs.
Exactly. We get that picture in our mind. Like whenever you
Yes.
whenever you hear the name research, we think that,
Mm,
okay, a person is wearing their lab coat and working in some laboratory. So, no,
correct.
that's not everything here.
Correct. That is a very common thing actually, because that word
Very,
is
yeah,
like this, research.
right,
So yeah,
right.
very well said. We don't have to work in labs like a scientist or what you see in images,
Yes,
nothing like
yeah,
that.
yeah. It's completely different.
Yes, yes. And yeah, second very good part is like I also agree with this is because you don't have to interact with patients. So many times we think that impact, we are not creating that much impact.
Right,
But
right,
yes, you very rightly mentioned that impact is much bigger, on a bigger level, global
right,
level actually.
right. Yes.
And so that is, yes, very true. So yeah, with this, Satira, I just want to know from you, because being from a nursing background, where when you were very clear from your college life itself that you have to come to non-clinical. Okay,
Mm.
so I want to know from you, because you must have something in your mind during your college days. You must have seen something maybe in your college because of which you decided, okay, this is not for me. So I want to know from you, like, what are the five differences, major differences, working as a nurse in hospital and working as a pharma professional in a corporate setting.
Okay. Well, both are completely different. Like the process, the setting, the environment, the work, the people who you interact with, everything is different here. So I guess maybe rather than just saying five differences, I can maybe say a few benefits that I have experienced working as a
Hmm.
coder in these years. So, we all know that nursing is a much more physically demanding profession where you have a fixed shifts, right? Like including nights. So, and we see wages issues in private sectors. Plus, the patient nurse ratio is much lower than the recommendation from WHO, which results in stress and burnout and everything. So, comparing with that, being a coder, I use different online systems and tools. We are laptop users basically. So, which gives us flexibility to work from almost anywhere, flexibility to work at our own convenient hours most of the time. And I have personally felt that work life balance is much better here, and along with that, it comes with the perks like insurance, health checkups, generous leave policies, transportation facilities, and all. So I guess these are few positive differences or benefit which I have felt personally working as a coder over these years.
Yes, true. Even I agree. Yes. I mean, it's totally different
Yeah, it's completely
setting.
different.
Yes.
Yes,
But there are a lot of benefits, flexibility, yes, medical
right,
insurance. And as
right.
a female, I would say maternity leave is the best part.
Yeah, exactly. Even few companies gives paternity leaves as well. So,
Yes. Yes, now they have started actually.
yes.
So
Yeah,
maternity leave is the best time, and when you get extension also. Like
right,
I got
right.
extension when I got maternity leave.
Okay.
So, and even after that, your manager understands, okay, this person has joined after
Right,
maternity leave. So they
right.
give you that flexibility, they
Yes,
support you.
yes,
So that kind of environment we get, yes, it's very supportive.
yes. It helps us also, in that setting. There are a lot of programs also which happens like wellness
Hmm.
programs and everything, which helps you to mold as a person. It helps you to improve your career, personal well-being, and everything. So there are much more perks to this. I have personally felt that.
Yes, yes, true. And even I experienced that in my corporate life. So,
Right,
Athira, because I just want to know that we are talking about, okay, I joined as a coder, so you joined as a coder, now also you are
right.
into coding.
Yes.
So, our audience want to understand, maybe in some layman terms, you can just explain what is this coding part, because there is one called medical coding also,
Yeah,
and this
right.
is clinical coding, right? So
Yes,
we want to
right.
understand like what you do as a coder, maybe your day-to-day life.
Sure,
Yeah.
sure. So maybe I can give the differences as well.
Yes.
Because you have just mentioned the medical coding, which is actually insurance-related coding. So I'll start with that. So insurance coding is completely different from what we are talking about currently. So that is, as the name suggests, it's insurance related, reimbursement related coding, which is mainly for healthcare services. That's a different field. Life science graduates are a good fit. Even other pharma professionals, medical professionals are a good fit for that. So, clinical research coding, on the other hand, is completely different. It is related to the drug development, where there are many departments in which coding is mainly a quality check department where you check and categorize the terms based on dictionaries for better analysis purpose. So that's the easiest way to
Hmm.
tell that. Yeah.
Yes. So, like Athira mentioned, see, there is a difference between medical coding and clinical coders. So, medical
Yes.
coding belongs to the insurance industry,
Right. Right.
that entire RCM, revenue cycle management,
Right.
that cycle. And yeah,
Yes.
clinical coding is something to pharma industry.
Yes.
So
because the many
hmm,
people get confused, like many
yes,
freshers they get confused. And I always used to get queries like, we see this opportunity as a medical coder, so can you
yes,
help me refer, or can you help me like what I can learn and everything. And when we see the job portal and the GD, it will be for some CPC certification they'll be asking, which is completely different. So
hmm,
the advice would be, if someone is actually searching, sometimes for both the jobs they call it as medical coding. So
hmm.
the key is you have to go and check their profile, go check the company, what all products they are making, and check the job description properly. Then you'll get an idea whether it is related to clinical research, the drug development, or it is related to insurance. So that's the key. You have to go and search properly.
Yes, wonderful advice, I must say, because like you said, most of the places you will find similar name. But
Right,
for all the audience, you have to read the job description properly.
right,
And
right.
when you see the company name from there, also you will get to know if it's a medical coding company or a pharma CRO,
True.
what they do. So from that
Yes,
also you will get to know.
yes, yes,
So yeah, reading job description carefully, thoroughly is very important.
yes.
So with this, Athira, next thing, if you could give few advices to nursing graduate who want to start fresh, let's say they want to
Okay,
start from today, what all
okay.
few things they should be doing to get inside pharma industry?
Okay. So, well, I would say the advice would be to start searching early and try to identify where you can truly excel. So, the thing is, Nima, conventional nursing is a great path, or all this actual fields, like we say, the MBBS,
Hmm.
doctors, pharmacists, even nursing, it's a great path. So, but the thing is, if you believe that you're meant to be a nurse and you can thrive in that role, then just go for it. Don't look back. But if not, there are several non-conventional fields that value your knowledge as a nurse and the professional nursing degree you hold. So to enter into those industries like pharma industry, you have to start searching early, and you have to get very good guidance. Like, if you want to get guidance from an experienced people, you can do that. And there are several institute, right? So if you want to get advice from them, if you want to get certified, just do that. Because nowadays it's not very easy, the walk-in interviews and everything, it's not very easy to get into this industry. um because it's competitive nowadays, and demand is pretty much high. So just start early, because I have seen many people who they think that during their education time, they'll think like, okay, maybe I'll wait for my graduation period, or maybe I'll wait for one more year to look into some other opportunities. So don't waste time. Start looking early if you don't feel that you're not fit in some place. And there is nothing wrong in that, right? Because at the end of the time, you just want to feel good at a place where you work at, right? So just focus on that and try to identify if you truly excel where you stand now, or else, yeah, just start searching for other opportunities. There is no wrong in that.
Yes, very good advice actually. Like you said, if you really like the conventional pathway, then
Yeah,
no looking back, just go deeper into that. That would be the
right,
best thing to do.
right, yes,
But yes, not everyone is made for that.
exactly.
Also, that is very common in our, I would say, Indian society. Even, when I did BDS, now I realize that I did not have much option. At that time, people were going towards engineering or medical
Right.
field.
Yes, yes. We are very biased in many things,
Yes,
right?
correct.
About the education, about the profession.
Yeah.
We just see like a few roles are there, and we just think that, yeah, everybody are doing it. Why don't we do the same? But no, that's not a case. Something else will be there all the time. And one more thing is, sometimes you'll not understand it once you start with your education.
Hmm.
Otherwise, yeah, if you understood when you are like maybe 10 years
Hmm.
old, definitely you could have changed your education itself, right? But we don't get that opportunities or knowledge or ideas at that point of time. And we get all those details maybe once we have joined for a particular
Yes.
course. So then there is no point like thinking, okay, maybe this is a waste, I wasted my 4 years, 5 years. Just don't do that. There are a lot of other fields. Just the thing that people don't know about it. So that's the problem. So I guess getting that proper education knowledge about opportunities from wherever you can get it, that's very important. Go get the information from a very good source. That's why I said we have institutes which can guide you. There are people who can guide you. So many people are approaching nowadays through LinkedIn, like, can you give us what is this? So that's good, I would say, because see, people are trying, at least graduates and everybody, they are trying to
Hmm.
be excel, trying to fit in. So that's really good. I really appreciate it.
Yes, true. So yeah, like Athira mentioned, you need to find out, okay, if it's
Exactly.
exactly for you or not. If it not working for you, just move on and look for other options. There are so many options out there, non-conventional.
Right. Right.
Especially nowadays. There are
Right.
so many. I have seen many doctors, they are doing, they have their YouTube channel, they have entirely, they are not into clinicals, they have a full YouTube channel. Many are into comedy also.
Right. The
Right?
stand up
Stand up
peoples, yes.
comedy.
Right.
So yeah, just
That's what we never thought about all these things, right,
correct.
during our education period
Uh,
and all. Yeah, but it's blooming, and I'm very happy to see all these things coming out from people.
correct.
It's really good.
Correct, correct. So with this, Adira, our last question is very important, which we ask to every expert because now it is the time of automation, Chat GPT,
Yeah.
and Siri's, Gemini, what all things, so yeah, in this era of automation, AI, machine learning, and all. As per you, what is the effect of automation in pharma industry or pharma jobs?
Okay, so yeah, we use AI in general in pharma jobs and everything, in the companies as well.
Hmm.
Um, we even as a coder, we use it in our day-to-day coding. It helps to improve the efficiency, and we use it for analysis purposes. And it's still a blooming area. The AI has a lot of potential. So we are still thinking about it, and we are yet to see major outcomes and everything. It's same for our field as well. And I guess um, even nowadays people use ChatGPT for each and everything, right? Just for everything. So like that, yes, it has its own effect in pharma industry as well, and we are yet to see much major effects in future.
Mm, yes. So, like Atira mentioned, yes, already AI is in use inside pharma
Yeah,
industry. And yes, everywhere it's in use, but yes, it can't replace humans.
yeah, never.
Yes, so there will place for humans always. Yes, so yeah, more opportunity will come for the people who know how to use AI.
Exactly. Yeah.
So that will be the main thing coming forward, and let's see how much is going to take.
Yes, yes.
Yeah.
There are, I guess, so many trainings and everything
Hmm.
available based on like how you can do the AI machine learning and everything. So
Correct.
that's actually a good thing if you want to improve in your career, to go up in your profession. It's a good thing to follow all those.
Yes, yes. So yes, Athira, so now let's start our rapid fire round.
Sure. Okay. Fire then.
Yes. So your answer should be yes or no, or maybe just one sentence depending
Okay.
on the question. Very
Okay.
short. Okay.
Okay. Okay.
Now, clinical or corporate, what excites you more?
Corporate. I chose the path, so
Yes, that's why you are here with us sitting
yes.
today.
Yeah.
One skill that helped you stand out.
Okay. One skill I would say poise. Yeah.
Great. Third, resume tip every fresher must follow.
Oh, that's a good one. I would say keep it simple, keep it short, one single page, and add the details which you are 100% sure of.
True. Not just for the sake of adding too
Uh,
much information.
no,
It never impresses anyone.
it never impress. And after a point, when they ask questions from your resume, you start to blabber out and you're just gone.
Correct. So that is going to be a trouble for you only.
Exactly. Yeah.
Yes. One common mistake freshers make.
A common mistake, I would say being a smug, because sometimes, people tend to settle too early, even if they have so much potential. So don't
Hmm.
do that. Gain experience from different tools, from different areas. Go as far as you can. It'll help you in a long run. So that's why.
Correct. And you are never settled.
Ah,
Let me tell you this thing.
never.
The day we settled, we gone.
Exactly.
So competitive everywhere, right?
It's very competitive. You have to be on your toes all the time.
Yes, yes. So yeah, LinkedIn or job portals, which one got you more interviews?
LinkedIn, I never used any other job portals.
Oh,
Yeah.
great. Yes, even we tell our community members and audience use LinkedIn as much as possible.
Yes.
So
It's
people
it's a
know, but they
really good
don't know how to
platform.
use it actually.
Exactly. Because it allows you it's a pool, right? It's a
Hmm.
pool of people with lot of information and knowledge and potential. So try to connect with people if needed, and try to get the information from them. There are many people who are ready to help you. There are many people who can give you the right information and who can help you actually. So just use it. It's really helpful. I have felt that.
Correct, correct. So for you, Athira, your first job was luck, skill, or strategy?
Um,
Now I
luck.
can answer this because I have heard everything, but now I want to hear from you.
Okay. Luck, no. A skill and strategy. Strategy is also a skill, right?
Yes.
Skill and strategy. Yeah.
Yes, yes, you have a good strategy actually. You were so much aware. You took the course, you just made yourself,
Yes.
you had that foundation, right? So, yeah,
Yes. Yes.
yes, a skill and a strategy. So, yeah, if not pharma, what would you be doing?
Um, Honestly, I never thought about it because at that point of time, I never had any other choice, or I never kept a second option. This was it at that point of time. And once I joined, I never looked back.
I must say, so clear. Crystal clear.
Yes, at that point of time, yeah.
Now also you are just progressing in your career.
Yes.
uh, I mean nothing could be good than this, because
Yeah.
I have seen people even when they join industry and all confused, they are confused,
Right. Yes, yes,
right?
yes.
So
Yeah.
having clarity, it's very important.
Yes, yes.
So yes, Atira, next is your biggest professional turning point.
Okay. My biggest professional turning point as a coder, maybe the biggest one yet to come, maybe I can say like that. But if we take my entire career, including the education, I would say that the moment I chose this pharma industry was a biggest turning point for me.
Great, great. And yes, with this, the last rapid fire question is one tool or software you can't survive your day, I mean, which you use in your daily work.
Okay, so one tool that would be the coding tool, which is company specific. So each company has their own coding tools. That would be the one for sure. And along with that, the dictionary tool. So we use two different dictionaries. One is for medical terminologies, which is called the Medra. The other one for medications, which is called the Hodrack. So yeah, all this. Without this, as a coder, I cannot live.
True.
It's very important. Yes.
Yes, yes. So these two tools are very important part of
Very,
any, I
yes.
would say, clinical coder, not
Yeah,
medical coder.
yes.
So Medra and yes, who do you do? That is
Code run.
WHO.
Yes, right, right.
Yes, true. Okay, Athira, so that was all for our podcast today, and I really liked. I mean, the one thing which I liked from this entire podcast, and yes, with this conversation is you were so clear
Yeah,
from your
okay.
college days itself, because I already mentioned, right, I have never seen any expert who was so clear, because everyone did some sort of clinical or maybe into their core field and then they moved to non-clinical.
Right, right.
So I mean, because that clarity they did not have.
True.
So yeah, although it's never it's not like you are late, or it's better to be late than never, as we say.
Exactly. Yeah,
But
exactly.
also I think, if you are very clear from in your early days or your beginning of your career, it somehow it lessens your struggle
Right.
phase
Yes. Yes.
comes
Yes.
down.
That's very true. That's very
Mm,
true, Nima. Because I knew that I couldn't continue
mm,
in the conventional role. At least I knew that when I
correct.
was when I completed my course, and that resulted in so many, I mean, so many other courses, searching and everything. But at least I was clear about one thing. So yeah, at least we should have that idea by the time you finish your college or graduation or degree, that is this is the one which I will be excelling, or should I change? Because that's the best time, you cannot change after couple of
Correct.
years and then you cannot go for it. Yeah, people are there who does all these things, but it's very difficult in our society. So yeah, be
True.
clear about what you want to be.
Hmm. Yes, clarity is very important.
Important.
Yes, so yes, for all of our audience, so this was my take from this entire podcast. If you are clear, that is very important, having that clarity and just continue in that. Definitely, sky is the limit in every
Yeah.
field, whatever you do, but you
Yes.
should be
Yes.
having clarity if it's for you
Right.
or not.
Exactly, Nima.
So yeah, I want from our audience that what was their learning through this podcast. Please comment your learning, any one point which you find, yes, it was for you, or maybe any learning you had, or maybe anything you liked about this podcast, or maybe anything new you got to know for the first time through this podcast. So please comment below that. Also, for all the nursing graduates out there, if you have any doubt, anything, or maybe if you have hesitation, maybe something in there in your mind which is stopping you to step into non clinical, or I would say non conventional roles, then please comment that as well. We will more than happy to answer you, and yes, we will more than happy to give you the clarity. So, with this, we are going to conclude this podcast. And Athira, thank you once again for coming on Saturday. That is your off day, giving your valuable time to us and giving your valuable insights to us. Thank you.
Thank you so much, Nima. And I really loved the questions. They were really good and appropriate to the topic. So yeah, thank you so much for inviting me to the session.
Thank you, Athira, and all the best for your career. And definitely, you will shine in your career further. And yes, we can have another podcast also.
Sure, yeah, I would love to do that. Thank you. Thank
Maybe
you.
we will talk more on inside things in that podcast.
Sure, sure. Love to
Thank
do
you,
that.
Atira. Thank you once again.
Thank you. Bye. Have a great day.
Bye bye.